Hi everybody, I'm Bethany, and today we're going to discuss Pharmacology Chapter 9. So if y'all pull out your books, it's this little bad boy right here. It says Pharmacology, Clear and Simple. We're going to go ahead and review quickly a little bit about enteral medications and administration of them. And it's on Chapter 9, page 157. That's 1, 5, and a 7, okay? And so if you turn to page 158, we're going to go a little bit into detail about what exactly are enteral medications. So enteral medications include any medication that involve the GI tract, the gastrointestinal tract, that includes your stomach and your intestines, such as capsules, tablets, enemas, suppositories, and many others. The most common enteral route of administration is the oral route. And oral means oro. If you guys remember from intro mod, medical terminology, oro means mouth, AL means pertaining to. So if you ever have someone that needs to take a medication orally, you know that it needs to be by their mouth. Okay, most common medications are given orally. They include antibiotics. If you have someone with an infection, the physician might prescribe them an antibiotic to help treat that. Also, antacids. Any of y'all ever had acid reflux or ate something spicy or something with a tomato acidic base and you got a little bit of the heartburn? You're like, oh, I need some Tums. Those are antacids. And also antihypertensives, okay? And antihypertensives are medications that are used for those patients that have elevated blood pressure, better known as hypertension, okay? If you look down to the bottom of page 158, it goes into a little bit more detail about oral solid medications and how to administer them. Okay, so oral medications can be either solid or liquid. Solid forms include tablets, I almost combined those two, tablets and capsules. Tablets are discs and they're compressed medication in distinctive shapes and colors. Oral drugs are frequently poured out of a bulk, a multi-dose vial. I do have an example. This is what we would call our standard ibuprofen. I don't know if you can see that. And these are tablet form, okay? And if I give you an example here, I don't know if you can see that, but this is a tablet, okay? It's pounded down. It's a solid disc, okay? I can't just break it apart willy-nilly. I would have to get a pill splitter to split it in half. I would have to swallow this whole or chew this in order to get it crushed, okay? It's not something that I can just pull apart. All right, that's an example of a tablet. Sometimes tablets can come in packet form. This is an example of a packet. This is actually a steroid Medrol dose pack. But as you can see, it gives dosing directions, and then these are tablets. These are not capsules because I cannot pull them apart. But if the patient reads the directions, they just press into the packet, and then the pill comes out the back. Okay, can't really see that, but that's the tablet. Okay, so those are tablets. A group of unit doses may be contained in a blister pack, which may be opened gently by pressing on the tab so that the pill falls into the medicine cup. Always wash your hands before administering medications and avoid touching the pills to prevent transfer of microbes to the patient. I don't know about you all, but I don't want some random person touching my medication if I'm going to take it orally or anyway, as a matter of fact, because I don't know where those hands have been. Okay, so the trick is that if you are going to administer medication to a patient, you want to not touch it. If you do have to touch it by any means, make sure you're wearing gloves. Or if you don't have access to gloves, make sure that you are handing it to them with hand-washed hands, okay? But ideally, you want to minimize the touching of the tablets as much as possible. Most of the time, doctors' offices will include little medicine cups. They almost look like when you're a kid and you have the liquid medication and you pour it into a little cup, they look like that. And all you would literally do is take from the multi-pill bottle and pour it, how many tablets you need, 1 or 2 or whatever the dosing is, into that cup and then hand it to the patient and they would take the pill, okay? You never touched what pills were in this bottle. Okay, at the top of page 159, it says, sometimes a tablet must be crushed before it is administered. These tablets can be mixed with food or a liquid to make it easier for patients to swallow. A pair of devices called a mortar and pestle is used to crush pills and tablets. And most clinics have these available as well. And it's like a bowl, and then it has almost like a little sledgehammer. And you literally put the pill into the bowl and you grind it up and make it into a fine powder. And the idea of that is you are going to administer that to patients that can have really a lot of issues with swallowing. If you can imagine, if your throat is already narrow and you're having issues swallowing, and then you have to take one of these tablets and swallow that, could get hung up in there, they could choke on it. While they're choking, they could aspirate, which means it could go into their lungs. And so if you have a patient with those type of issues, or sometimes there's some of those out there that can't swallow pills. It's just a mind thing. It's a mental thing. So if the medicine can be crushed, you want to do that and then put it into some food, maybe a liquid like water, juice, whatever, because if you think about it, if it's crushed into something, they're not going to think like, okay, there's medicine in this. It might taste really bad, but they're going to be able to swallow it, which is the important thing. It says tablets can be coated to improve swallowing or prevent release in the stomach. Enteric coated drugs are released not in the stomach, but in the intestines. They are especially useful for patients with stomach ulcers or sensitivity. Buffered tablets have added antacids to prevent stomach irritation. Tablets can be scored, so that means they have a little indentation in them, okay, for easy separation if half of a tablet is needed. Capsules, and I'm sorry, I don't have an example of a capsule around me right now, but capsules, if you notice on the bottom of page 159, it gives you a picture of them. And they are time release or delayed action form that prevents it from being broken down in the acidic environment, which if you face it, your stomach, your intestines have a ton of acid in it. Why? Because the acid is breaking down all of your contents and absorbing into the body. Instead, the capsule breaks down in a more alkalytic environment of the small intestine. Did you know that you have 22 to 23 feet of small intestine in your system? So that's a long way for it to travel, right? But that gives, if you think about it, that gives a lot of time for those capsules to be broke down. Adderall, which is a medication used for ADHD and ADD patients, is an extended release capsule used to treat attention deficit hyperactivity disorder. This medication is given only one time in the morning, and timed release action allows the patient to take it less often. So if you think about it, if someone is taking a capsule and it takes the pill to get to the small intestine in order for it to be broke down, it's almost like a time release thing. So if someone is taking a capsule, when they take the medication, it is not automatically distributing the medication. It's slowly releasing it over time. Okay, and sometimes for specific types of medications like ADD medications, pain medications, sometimes we have to think about these things because we don't want to just get the relief, boom, right then and there. We want to get it in a slow, condensed speed. Okay. If you also notice, if you take a look at the picture of a capsule, you will notice that those capsules, you can literally pull them apart. Okay. And then it's got the little powder inside. All right. So if you did have a patient that had a swallowing issue, like dysphagia, something like that, you can take those capsules apart and pour the powder's already in there. The capsule is just to help the release of the medication. Okay. Pills that shouldn't be crushed. So it says at the fast tip 9.1, it says not all pills can be crushed. For example, pills coded to slow the release of a drug, like enteric-coated tablets or time-release tablets, should not be crushed. If in doubt, contact a pharmacist or check your drug resources to see whether a tablet can be crushed. When in doubt, just call somebody and ask a question, right? Because the pharmacist is going to know, and they're going to tell you yay or nay on if this medication can be crushed or not. If it can't be crushed and the patient needs to have it crushed, then you might need to tell your physician so then they can come up with another alternative, right? Because the goal is we want these patients to get their medications. We're going to go ahead and turn to page 160. 160 talks a little bit about oral liquid medications. So at times, solid medication is not the best option for oral medication administration. Patients may have difficulty swallowing solid meds, or the medication needs to start working sooner than the solid form allows. I think in this instance, if you have patients that are in hospice or are post-op after severe surgeries and they take pain medication in tablet form, sometimes that they need immediate relief, especially in hospice. And if they're having difficulty swallowing already, we're going to want to go with the liquid route, right? Because it's instant pain relief for them and they're able to swallow it. Okay. If you have a patient with difficulty swallowing, liquid's the way to go. Also, kiddos. If you have a patient that is a pediatric patient, let's say for instance this patient is like 10 or 11, you might want to talk with parents before you call in the physician's prescription medication, right? Because if it's tablets, that physician might have not discussed it with the parents and thought that maybe this kid could swallow pills, and in fact they can't. Okay, so that's just a real world thought there. If you have a pediatric patient, make sure you're talking with parents to make sure that they're able to swallow the pills if it is in pill form. It says there, liquid medications are easier to swallow and more quickly absorbed than solid forms. They are available in a variety of compositions. Some examples are Alka-Seltzer. You got, let's see, trying to think. Pretty much any medication can come in liquid form. There's liquid morphine. There's Alka-Seltzer, milk of magnesia. Sometimes like antacids can come in liquid form. Okay. There's a lot of different types of liquid medications out there. Another form of liquid medication is an elixir, okay, and it's named because it contains alcohol in the preparation. The alcohol helps to dissolve the medication and make it more palatable. Dimetapp elixir used for colds is an example, okay, so that grapey flavored Dimetapp, it has some form of alcohol in it, okay, so if you are taking a cold medication, be very mindful about the alcohol content. Make sure that you're looking at that, right? Another thing is